3.
Hello, I am Nurse Winifred, and I am here to do a respiratory assessment on, ma'am, what is your name? Zelda?
Zelda.
Zelda, on Zelda. Zelda, as you see, has a snow cone on her chest. So we're going to have to work around that and see what happens and see what kind of, she might have some wet lung sounds with that snow cone. So we're going to do our assessment. So I'm washing my hands, and then I am going to go in and I'm going to inspect. Remember that when you are looking and inspecting, anytime you're doing an assessment, you want to uncover the area that you are assessing. We will not do that today. No, we will not. But remember that the patient during a respiratory assessment, the patient should have their head of their bed 30 degrees or sitting upright. Okay, so I'm gonna walk in. Hello there.
Hello.
How are you?
Fantastic.
Okay. Are you having any trouble breathing?
No.
I don't see any, her skin color looks fine. I don't see any blue, which is cyanosis, which is not compatible with life, the color blue. So everything looks fine. I don't see, even though she has this snow cone, I don't see any signs of distress at all. I don't see any accessory muscle use, and remember those accessory muscles were the sternocleidomastoid muscle, the scalene muscle, and the trapezius muscle were the 3 muscles used in accessory. Sometimes the abdominals if it's really bad, but right now, even though she has a snow cone, she's presenting with normal respirations, and you're not having trouble breathing, right?
No.
All right, so let me see your hands. I'm going to check for capillary refill, and it's fine. I like to talk about circulation. All right, so now let's do the chamois sign. Put your fingers like that, and so you can see that hers are fine, and we do that for, everybody should know that's checking for clubbing. So are you having any kind of cough?
No.
Okay. So now I'm going to look at the symmetry of her chest wall. I'm looking for any bulges. She does have this right here. I don't see any other lesions or anything. If I'm checking for anterior posterior diameter, because of, remember the anterior posterior is this way, and because this is here, this growth is here, then I would say it's 2 to 2. It should be 1 to 2, but it looks like it's 2 to 2 now. Remember also that those other patients that might have a different diameter would be somebody that had the pectus excavatum or pectus carinatum. So now I'm going to check her pulse oximetry. Is that here? Okay. I've turned the machine on. Okay. And it's 99, so that's very good. I don't hear any audible sounds in terms of respirations. Her respiration, I've counted, is 16, and that's normal. So now we're going to go down to the next area, and that's palpate the chest. And this is in your textbook on page 427. I'm not going to palpate all the way down, but we'll start up here at the sternum, at the clavicle, and palpate over the clavicle and then below the clavicle using the pads of your fingers. And remember that you're palpating through the intercostal spaces as well as you go down, and the rib is, the intercostal space is named for the rib above it. So if you've got the second intercostal space, it's named for the second rib, which is above it. So now I'm going to go to the back side, and I'm going to palpate back here, and oh my goodness, here's another snow cone. So I'm going to palpate and can you cross your arms? Okay, so remember, crossing the arms helps open things up a little bit. So you can palpate. All right. I don't see, let's see, one of the things I forgot to do is have you bend over. All right, so I'm looking for kyphosis or scoliosis. So this would be, I'm not exactly sure how to describe this, but remember kyphosis was and scoliosis, kyphosis and scoliosis both you can stand up, both can affect your breathing. Scoliosis is the S-shaped spine, and then they call kyphosis a humpback. So
I've been told I have a snow cone spine.
oh, that's okay, snow cone spine. So we'll have to investigate that and research the snow cone situation. Okay, thank you for that. Always listen to your patient because they know what is going on with them. Thank you for that information. All right, so turn around, and what we're going to do is we're going to do the thoracic expansion, and that also is in your textbook, and you need to know how to do this. And so it's going to be a little bit hard to see because I have to work around the snow cone. But so you put your hands right here, and that's about about the 10th rib, which is what it would be, and then you have her take a deep breath, and so you can see the thumbs move out symmetrically and equally, and so that means good thoracic expansion. Thank you. All right, so now the next step is percussion, and that also is on page 427. Percussion, remember, tells you if it's air-filled, fluid-filled, or solid. You really only percuss if you expect or suspect some kind of issue going on. So over the lungs, remember that sound we should hear is resonant. You also percuss underneath the clothing, and I'm gonna percuss, but I'm not gonna hear the right thing because I'm doing it over the clothing. But I'm gonna show you the process. So to percuss, I'll do like this, and over here, and then you work your way down, and you'd work your way down. Remember, with females, it's better to do it closer to the sternum. And then on the back, the same thing. And remember, the apices of the lungs are, you want to start up higher. So you're going to do down. Remember, there's a pattern. There's an exact way that you are supposed to go. So after you do that, you're going to auscultate. We're going to use the diaphragm of the stethoscope. This is the bell. This is the diaphragm. So the diaphragm is what we're going to listen and auscultate the lungs with. So we're going to follow the pattern. We'll start at the back. So remember, you start, make sure your stethoscope is right. Start up here again next to the close. Deep breath. Above the apices. Go down. Make sure they inhale and exhale a full time. And then to the side. And then over here. And remember, the video that I posted showed you how to divide up what you're listening to when you've got your right upper, middle, and lower lobe and your left upper and lower lobe of the lungs. Then on the anterior side, we also start up here. It sounds wet in here, like she's congested. Are you sure you're not coughing up anything?
I'm sure.
And then in and out. Okay, perfect. All right. So remember that you're, as you auscultate or move the diaphragm of the stethoscope into various positions, you're going to listen to bronchial sounds over the trachea and larynx. Those are loud and high-pitched sounds. The bronchiovesicular sounds over the central area of the bronchi, and the vesicular sounds over the lung periphery, and those are the soft and low-pitched sounds. The abnormal lung sounds are called adventitious sounds. Those are things that we talked about in class, such as crackles and wheezes, rhonchi, and rubs. If you listen or hear any of those adventitious sounds, you want your patient to cough and clear their throat, and then listen again to make sure that they coughed up what was bothering them. So in terms of documentation, no accessory muscle use, no intercostal retractions. Remember, we talked about that. No nasal flaring, no pursed lip breathing or clubbing, no chest pain, shortness of breath, dyspnea, cough, or tenderness on the chest wall, respiration's regular rate and rhythm, breathing without difficulty. AP diameter in a normal person is 2 to 1. Remember that?
Not that I'm not normal.
Not that she's not normal, but the snow cone throws things off a little bit. Air exchange heard in all lung fields. Vesicular breath sounds clear over the posterior lung fields, and then bronchial and bronchovesicular sounds over anterior lung fields. No adventitious sounds heard. Chest wall and expansion symmetrical. Remember, one of the things is we're always looking from side to side and making sure that things are symmetrical, that they match up. That's one thing that God gave us, that I always say God gave us pretty much 2 of everything so we can match one side with the other. So that is your respiratory assessment. Happy Halloween!
Happy Halloween!